Hi, everybody. Thank you so much for joining us today on the second episode of Dentistry Beyond the Numbers. Last episode, we discussed how we're going to talk about the hamsa, the dental hand. There's a lot of meaning to the word hamsa in the Mediterranean world, and that is that a hamsa, or the hand, has a lot of enrichment, the sustenance for the human body. And that's what I believe that the hamsa, or the dental hand, will bring a practice. Today we embark and we start guiding our listeners through the procedures, because everything that we do in dentistry is going to start and end with clinical excellence. You cannot run a profitable, EBITDA-driven practice without doing fantastic work. And we're going to get into why. I'd like to bring back a dear friend, and my cohort in this is Rolando Mia. Ro, that smile is perpetual. I love it. I love that smile.
Dr. Marc Liechtung.
Everybody. How are you, Ro? How's everything?
I'm so good. First of all, I appreciate that you're giving me opportunity to join you on this. I know you're going to be bringing on other people. It's just honor. I love the first episode, and I've been thinking about your hamsa and the context around it. That blueprint works so well because it kind of frames it. So looking forward to this episode. And you said it all about clinical. So let's.
Yes. I mean, clinical is, dentists spend their entire, I don't care if they're high end or middle, Main Street America, they spent their careers on trying to develop, I would hope, quality dentistry. Well, I'm here to tell you now that in order to have and solve that problem that we're seeking is to help dentists sell their practices for the utmost millions, if possible, rather than a percentage or hundreds of thousands. And to do that, they must take hold of their practice and understand clinical excellence is paramount. We're going to start today, our second episode, with discussing what we ended off with last time, and that is our dental hand. And we're going to talk about, if we could bring up that hand, please. Thank you. So we remember from last time that this dental hand encompasses everything we're going to discuss. But we're going to break them down today, episode by episode during this journey. But today we're going to discuss the 5 fingers. And wow, technology, I love it. So today, right, Ro, is that beautiful? Today, it's a blank slate. And all I'm presenting to you, the listeners, and again, thank you, is these 5 procedures that I believe truly makes what I call a super general dentist. Years ago, I had a tremendous mentor. Unfortunately, he's not with us anymore. His name is Dr. Dan Casulo. Dan was amazing in developing this concept for me. But years ago, we didn't have these procedures. We didn't have Invisalign. We didn't have rotary endo. We didn't have guided implants. We didn't have before and after photos of cosmetics. And we certainly didn't have the type of bone grafting and instrumentation we have now for surgical extractions. Think about it, everybody. Years ago, a super general dentist meant they could do full mouth roundhouses and take out an easy tooth. Today, we as general dentists can encompass and perfect so much. And that is what embarks and will take us to that next level.
Wait. So
go ahead. I'm sorry.
These procedures, these are based on the experience that you've seen, right? Or is this just...
it's a great question. As we're going to get into this blueprint, as we called it last time, right? We called it a blueprint. And we are going to get into this and understand that it is these specific procedures. Listen, somebody can tell me that sleep apnea is a great, or Botox, but that's not the guts and the sort of the soul of dentistry. Moving teeth, extracting teeth, root canal, capping, that's what this is about. But I'm looking for offices to generate this and produce this in their practice. Before we get into that, I think it's important to understand that, and we're going to talk about it next time as well, is this is the foundation for comprehensive treatment planning. We're going to talk about down the road, but these procedures, Ro, to your point, are the absolute crux of the dental practice. Today, I want to go through each procedure and discuss with you why I believe these fall into that category of being the root, no pun intended, guys, the root of what we're looking for in a dental practice. For an example, I don't want to refer out a simple molar because there is no lab in doing that root canal, but we must learn how to perfect it. I have a son who's a first-year dental student, and he just finished his first year, and he asked me, Dad, should I specialize? And I said yes, in being a super general dentist, because today's world allows us. Let's take the first procedure, the thumb. It's clear Invisalign or clear aligners. There are many companies out there now that really can help move teeth. Some of them are just household names, and some of them are really also great products. Whichever one is best in your hands or your practice, great. But we need to be able to move teeth, or should be able to move teeth in our practices for the adults or the mid-level teenagers. And I mean that because today there are so many great educational components, so many factors that we could take, so many lessons we could learn on learning how to do Invisalign. I've seen practices that dedicate 70% of their general practice to Invisalign or to clear aligners. It's absolutely amazing. The reason is because there's so many Invisalign or Clear Choice or whatever your choice is, educational outlets. And we're not going to go through those because remember, this is Dentistry Beyond the Numbers. This is knowledge-based. I don't want to promote anything and I'm not selling anything, but I do believe going to your local courses and looking up, and if anybody has any questions of who's the best and what I found to be making the biggest difference in our practices, please give us a shout at Dr. Ibida, info@dribida.com, and I will gladly answer all of those questions. But the first in line is Align or clear aligners. We need to be able to offer that to our patients. The second is root canal therapy. Probably the biggest fear of young dentists is to sit down and do a molar root canal. And there's no reason for it. With the advent of rotary endo today, with the ability for you to gain courses in a day on how to finding the canals, measuring the canals, obturating the canals, we have the ability to do these molars and do these premolars and incisors efficiently. There are always going to be reasons to send out a case, but I really believe that they're sent out and not done. And we're going to get into further episodes of how root canal could be avoided and therefore creep back and become a problem. You know, Ro, so many young doctors avoid root canal and they pass it on, and maybe they'll insert a crown. Maybe they should have done a root canal prophylactically. Maybe there was some blanching, as doctors know out there, of the nerve. We have to be able to train ourselves to be able to give that to our patients within our practice.
Why? I'm curious. Why do they avoid these things? Why do they avoid, in your experience?
From the business, we're going to get into it, but it's really a good question. I mean, everybody has their own level of why they avoid. Some people avoid because they're putting in the crown and they want to get paid, or some, God forbid, but some people avoid it because they're scared of it. They don't want to start a root canal now. They had to convince the patient so much to do a crown, and now they got to tell them that they had decay into the nerve, and they're really nervous about that. First of all, doctors, one wise lesson you should learn: you dictate treatment. If they need a root canal, learn how to do root canals efficiently and proficiently, and therefore you will fear nothing. If Mrs. Smith needs a root canal, you explain to her the need and why, and that you don't want to put on that crown before she is comfortable underneath that crown, and we avoid any possible infections. But that's number two. Third thing that everybody loves, we learned it in dental school, we come out, we want to do crowns and cosmetic dentistry, veneers. But I see a real disconnect to doing some of the bigger cases. Doctors get nervous about occlusion. Doctors get nervous about torque. Well, like any great procedures, there are ways of learning and continuously learning how that doesn't happen, how we get a perfect impression. And today with scanners and taking proper bites and showing you a preview of the case, it's so much easier using technology today. And if we're not using technology, take a course, learn how to do that complete roundhouse or full mouth rehabilitation. Don't send things out and don't avoid that. If a patient needs an all-on-4, learn how to do an all-on-4. This is all falls under the umbrella of restorative. But these procedures, if you think about it, doctors, are the backbone. Unless you're a pediatric or a specialist, this is what makes up crown and bridge and cosmetics. Too many people come into me and I ask them, doctors who are applying for a job, and I say, do you do laminates? Oh, I did one. Well, laminates are a very common procedure it talked about in the common world, in magazines and TV shows. Every star, every actor or famous person on TV has laminates. We want to get into that arena. If you're uncomfortable in that arena, learn it, embrace it. These are the things that will embark on a productive, EBITDA-driven practice by understanding patient needs, patient expectations, and delivering a quality, well-occlusally oriented case that fits perfectly. The next procedure, is surgical extraction and bone grafting. It's a funny thing, and I want to pause for 1 second. When I interview associates, when I ask them, what do you enjoy to do most? And someone tells me, the doctor says, I really love surgery. There's something about a young doctor that likes surgery. They're a little more comfortable in the mouth. They're a little more comfortable in getting out the disease and the infection, what needs to happen. I find that whether it be surgical extractions, root canals, excavation of decay, I find that in our world today, we should be comfortable in removing teeth for emergency purposes, for patient care purposes, for just downright giving the patients what they need. And it's a great factor in dentistry. We do the right thing and production goes up. You are able to take that root tip out and then bone graft the region and give support to the arch or the ridge, which we're going to get into in episodes ahead. We are doing the patient a service. People that are taking teeth out and not offering bone grafting, like we're going to get into, just doing A, the patient's disservice, and B, the practice an absolute failure because they're not taking any future treatment into concession. We'll get into that. But these are the procedures. And last but not least, to me, with guided implants and computer-generated stents, implant placement today is really becoming something that every progressive, knowledge-based dental dentist should be looking into and doing. There's so many great courses, Ro, that people can really dive into and get to know these procedures, especially implant placement. I have a couple of associates that really gravitated towards surgery, and they love the restorative end. And think about it, everybody. We're going to get into next episode about how this all ties in these cases. Think about that young dentist that sees decay on tooth number 29, placing an implant on number 30, and then doing single crowns all on the entire lower arch. That's a general dentist without referral, doing it efficiently, proficiently, and patient satisfactorily. I mean, it's really amazing that patients, we're going to get into this as well, don't want to travel. They don't want to be, surprised with any fees. We're going to discuss this, but these to me are, in my experience and my knowledge of being in practice in the New York area, New York City, in Lincoln Center for so many years, over 30 years, these to me are the absolute must in going forward in dentistry today. If somebody wants to have a practice that they love going to, the diversification of procedures is never boring. Think about it, doctors. Drill, fill, and bill is out. Onlays, inlays fall into cosmetics, right? Root canal therapy could be done and no lab. We're going to get into all of this, but these are the procedures that if you're not comfortable at a certain stage in your life, then look to bring in specialists, but must offer these procedures in our office.
So
I'm
if
go ahead.
sorry, if a clinician skips one or another, what are the stakes? What are the ramifications of these? Why specifically these?
Well, we touched on root canal, but let's touch on Invisalign. I mean, if a patient comes to you and says, what can I do? You know, how many times does a patient tell me that they went to their dentist and they say they don't need any cosmetics? They're perfect. They're healthy. That's not they don't need. That dentist doesn't do. But if the dentist had Invisalign and was able to turn the teeth and get them straight, and then all of a sudden the spaces are equidistant, well, Mary, I think we should now do veneers. And without that, we're giving the patients a service that's a little inferior by drilling down the teeth because we don't offer Invisalign. So we might be taking off more tooth structure, opening ourselves up to more root canals without knowing how to do clear aligners or an Invisalign on that patient. You can take the implant placement. Ro, to your question, implant placement could mean to more bridge work instead of what patients do. Don't touch virgin teeth, do an implant.
So when you're looking at a practice, right? When you're looking at a practice and you're evaluating it and you don't see these, what is the impact of not seeing these in a decision, or how does it affect that practice exiting 10, 15, 20 years down the road? What happened? What's the impact?
So somebody could say the impact, it's a great question. The impact could be somebody says, oh, there's tremendous ability to grow the practice. But as a doctor who's selling, they're leaving so many dollars on the table because, oh, I referred it out to my friend Jim. Jim's not paying you any money towards your exit. So if in a financial standpoint, it increases your production and EBITDA. In a quality standpoint, you're offering your patients better fees, better quality because they're not leaving, and more controllable treatment plans. You're giving them a comprehensive treatment plan of doing something, and now they don't have to run around. You know, next episode, we're in this for the long run, listeners, and I thank you so much for being part of it. It means so much to me, and I'm hoping you're enjoying this because I'm enjoying just being your guide. I really am. I love it. As you can tell, it's tough for me to hide it. But I'm going to tell you, in the next episode, we're going to talk about a lot what Rolando just touched on. What happens and what is the difference in a practice that's doing implants, not doing implants? Let's talk about the numbers next time. Let's drill down a case where one is doing implants and one is doing crown and bridge. And we're going to see that the production is multifold. The ability to deliver the dentistry we want and the quality the patients expect is second to none. I want to thank you all for listening. I want to thank everyone who helps me with this podcast. We're going to look forward to seeing you in episode 3 in Dentistry Beyond the Numbers.